So look at the next obstetric issue. Now this is what is known as what? Dyspareunia. Alright. So dyspareunia is just simple. You just have to do it. You are having pain when you are having sex for women. Okay. So dyspareunia just refers to what? Persistent or recurrent pain. It's not only once. It's persistent, always. So the pain can be superficial at the vaginal opening or deep within the pelvis. So causes can range from physical issues or can also range from psychological issues. Okay. So for the types of dyspareunia, that's you feeling pain when you are having sex. It could be superficial, just at the vaginal opening during initial penetration. It could be deep pain, that's when basically it's inside, right? It could be primary, that's like the first sexual experience where you're basically being disvirgined. It's usually painful. It could be secondary, that one is like after, you are not having pain during intercourse, but later on you develop it. Situational, can be in some certain situations, like maybe you are not in the mood for sex, or you're not actually emotional attached and all of that. So common causes, physical causes can be due to what? The vagina is dry. Okay, like in a breastfeeding mother, in a menopause person. It could be due to infections like yeast infections, bacterial vaginosis, sexually transmitted infections. Could be due to skin conditions like lichen sclerosis. The woman has eczema. Could be pelvic disorders like endometriosis, pelvic inflammatory disease, fibroids. Okay. Could be due to pelvic floor dysfunctions. Could be hormonal changes or atrophic vaginitis. Could be after surgeries, or maybe the woman gave birth to a baby and there was trauma during the birth time. You can also have psychological issues causing it. So psychological issues like anxiety and depression, or maybe past trauma, maybe relationship issues, body image concerns. So diagnosis is you are just asking a lot of questions about her sex life, Then pelvic examinations, swab or cultures to test for infections, imaging, that's all those ultrasound, laparoscopy, because you want to see the internal, what's happening inside. Then pain mapping to localize and characterize the pain. Okay. So treatment options is if you are dealing with vaginal dryness, you can actually lubricate, topical estrogen for hormonal atrophy, antibiotics or antifungals for infections, the pelvic floor physical therapy, cognitive behavioral therapy, medications, that's for if it is nerve pain or inflammation, then what next? Surgical intervention is rare, but that one is maybe there's some structural issues, and all of that.